Hi everybody, I'm Daniele Manfredini and I'm here for another mini lecture on behalf of the Gruppo di Studio Italiano Disordini Craniomandibolari, the Italian study group on craniomandibular disorders. Today we are going to talk about 10 rules on temporomandibular disorders, which are the basis for an evidence-based oriented clinical practice. Rule number 1. Temporomandibular disorders are musculo-skeletal conditions. They are not pathologies related with dental occlusions. Rule number 2. The onset of TMD signs and symptoms is rarely attributable to a single etiological factor. This means that in most cases, the etiopathogenesis is multifactorial. Rule number 3. The diagnosis is based on clinical assessment and history taking. Rule number 4. There's no technological instrument of pseudo-technological such as electromyography, kinesiography, postural platform, axiography, and whatever you want that is actually able to do diagnosis, because the best diagnostic instrument we have is our brain. It is thanks to our brain that we are able to listen to the patient and to steer the diagnostic pathway in pain patients. Rule number 5. Imaging techniques, and in particular I'm referring to magnetic resonance and to computerized tomography, are required only in selected cases as a second step approaches to individuals who don't respond to common conservative treatments. Rule number 6. TMD treatment is rarely a true causal treatment eradicating the causal factor. So the rule number 7 states that TMD treatment is in most cases provided in the form of symptoms management, with the focus specifically put on the psychosocial correlates of pain as an experience, not as a nociceptive mechanism. And consequently, rule number 8 states that symptoms management can be usually achieved by means of conservative and reversible approaches: counseling, physiotherapy, cognitive behavioral treatments, physical therapy, oral appliances without predetermined occlusal designs, pharmacotherapy for pain control, and arthrocentesis. Rule number 9, as a consequence, suggests that irreversible occlusal treatments, such as those provided by orthodontics finalization, prosthodontics finalization, occlusal adjustment, any kind of oral appliances designed to search for an ideal interarch relationship, are not recommended at all, and they should not be used to prevent or to treat temporomandibular disorders. And this brings us to rule number 10, which states that patients with chronic pain require a multimodal approach managed by an expert in orofacial pain, with focus on phenomena of central sensitization and maladaptive pain experience. Well, I forgot the rules are actually 11, and the 10Bs states that there are simply some ethical concerns when we go outside the boundaries of evidence-based dentistry, because professional deontology requires clinicians to consider the patient and his or her pain, and not the dentist with all our unuseful technicism and dogmatism as the fulcrum of the diagnostic and treatment program. Thank you, and as usual, if you want to know more, please refer to all the events and Facebook page of the Italian study group on craniomandibular disorders. Bye bye!